Good evening, and thank you for joining us here on blackdoctor.org. And let me start by saying Happy New Year, because this is my first uh, Facebook Live of the year 2023. So I want to say Happy New Year, and thank you again for joining us. Real quick before we begin, I want to say we'd like to know where you're watching us from. So make sure you drop that in the comments. You drop in the comments wherever you're watching us from, all over the country and all over the world, because we've had some people from Liverpool, England, and South Africa and the Caribbean. So drop that in the comment section. Also, tag a friend. Share this on your page. If you know somebody that needs this information, make sure you tag them and share this on your page, because this is going to be a really, really important discussion to have. And then finally, if you have any questions, also drop those in the comment section. We'll get as many asked and answered as possible in the hour we have allotted. So I'm going to start by saying this. I've got a bit of a confession. I'm a football junkie. I love football. I played it as a kid. Even when my padded days were over, I played flag football with my buddies. I even played Ironman football, where you don't wear pads and you still tackle each other. Yes, and we were that crazy. We were young. Played Ironman football in college and did all of those things. I love watching football. I love the camaraderie when I played. I love the game itself. I started my son playing at the age of 4 years old, and he played all the way through high school. So really have a love for the game. But then something happened, and in loving the game, I gave an ACL to the game. I gave some fingers to the game. I gave a lot to the game, neck compression to the game of football. But I didn't complain about that at all, because you knew that was part of the game, and it was what it was. But then Monday night happened, and that changed a lot of things for a lot of people. It changed something for me with regards to watching a young man at 24 years old almost lose his life on the field. And when that happened, a lot of questions came. Questions came up about what is cardiac arrest. Questions came up about response, the NFL response, and then the response to witnessing trauma happen live. Someone almost die in front of you, a teammate, a friend, a son, a nephew almost die playing the game that he loved, that he worked so hard to get to this level. And so we decided to put this program together to kind of dissect and get rid of some of those myths, dissect really what happened, and then kind of give you some tips and techniques to, if you happen to come upon this situation, what's the best response? It can happen. What's the best response? So, as you can see, I'm not alone here. I've got some wonderful friends here. So we got Dr. Christopher Conti. He is an emergency room and sports medicine physician. He also focuses on concussion. So we know who we're talking about. And he's also he's been medical director for sports agencies and teams. And so he has been around sports. He's been a medical advisor for a number of sports teams and sports leagues. And so he's a wonderful resource. And he's out of Pittsburgh, Pennsylvania, where this young man is from, that Western Pennsylvania area. We've got Dr. Eric Griggs. You've seen Dr. Griggs on here before. He's been on many programs, and he's also the host of Get Check, Get Fit, Get Moving right here on blackdoctor.org. And he is really, and he's also a former athlete, former player, and so he can speak to what's happening on both sides. And then finally, we have Dr. Rhonda Maddox. She is a psychiatrist, and she has a new program that is starting here on blackdoctor.org. It says, "You're not crazy, but," and that is going to be starting on Thursday, tomorrow at 12 noon. She's going to be on every Thursday at 12 noon, kind of talking about mental health from a psychiatrist's point of view. And she is a wonderful, wonderful speaker. And so we're going to talk with her about the trauma and how do we recognize trauma, and how do we work through it when we've seen trauma happen in front of us. So I'm going to shut up, and I'm going to start with you, Dr. Conti, and really kind of give us some perspective on what happens when a sports injury emergency happens on the field from the medical side.
Well, it's great to be a part of this conversation, and unfortunately, it's when events like this happen that oftentimes we have the opportunity to have questions asked and answered. But we've got millions of people from 6 years old up to 96 years old that are participating in sports at either the kind of weekend warrior recreational level or at the high performance elite level. And with every sport, there are risks. To put football in perspective, at least here in Western Pennsylvania, and in most places, football, hockey, and the MMA martial arts sports are considered collision sports, and everything else is pretty much a contact sport. And the only difference is in those collision sports, you are purposely trying to collide with your opponent to try to affect a change. And, so in football, especially at the elite level, there are a lot of provisions in place that are often required. The NFL has requirements, the NCAA has requirements. Here in Western Pennsylvania, the Pennsylvania Interscholastic Athletic Association has requirements in terms of what the response capabilities are in the event of emergencies on the football field. And those contingencies include the training of the athletic training staff, the requirement that you have to have an athletic trainer on the field, and those athletic trainers have prerequisites that they're required to have, including CPR training, as well as immobilization of suspected injuries. And in Western Pennsylvania, and in most places, you have to have, at the very least, an EMS presence, a pre-hospital presence with at least emergency medicine technicians. But in most places, you have paramedics who can provide life-sustaining advanced cardiac and advanced trauma care. And so when all of those things are in place, you have, even in a tragic event such as Monday night, you have all of the personnel in place to provide rapid assessment and care. When this event happened, from the time Damar collapsed onto the field to the time that the paramedics or the trainers got on the field was 10 seconds. CPR was started shortly after that. The automated defibrillator made it to the field in less than 30 seconds. And so all of those things play a role. When we talk more about cardiac arrest in this conversation, one of the things that I want everyone to remember is what we say in medicine is time is tissue. And so with every minute that goes on when the heart is not beating and effectively pumping blood and oxygen to the body and the brain and the organs, the likelihood of successful revival, or what we call resuscitation, diminishes by almost 20%. And so, when CPR is needed, it should be administered quickly, as should a defibrillator be present. So in this case, all of those things were present and available for that response, which played an exponentially important role in the outcome. And so, as we go through this conversation, we can talk more about, what happens beyond the elite sports level, because that's where most of us weekend warriors are participating. And We're not going to have paramedics sitting at the park waiting for things to happen. And we're not going to have athletic trainers. It's going to be your coworker in your intramural league, and you're hoping that they, at least have a cell phone that's charged that can call 911, but hopefully they have some training in CPR or some kind of life-sustaining care. So again, it's great to be a part of this conversation, and I look forward to some good questions.
Absolutely. So Dr. Griggs, one of the biggest kind of debates that's been raging on the internet is, and people have been using the terms interchangeably, and that's heart attack and cardiac arrest. So can you kind of help us define those two things? Are they the same? And if they're not the same, what are the differences between a heart attack and cardiac arrest?
So typically, first of all, Happy New Year, and thank you. I've heard those put together so much today. I want to make sure I say it right. So your cardiac arrest is exactly that. It's when the heart stops beating. A heart attack typically has to do with the vessels of the heart, where there is a clot that can disrupt the heart beating, and it has to do with that you talk about people with their cholesterol and the blockages and the whole nine. Cardiac arrest, like we say that we've seen in this case, it can be due to the electrical impulses being stopped, meaning that the heart stops beating. Once the heart stops beating, the blood stops pumping. Does that make sense?
Yep.
Heart attacks can lead to cardiac arrest. Okay. The heart has 4 chambers. As y'all can see, I keep the displays with me, the examples with me. There's 2 atria and 2 ventricles. There are electrical impulses that work to have the atria, the top 2 small windows of the heart, the small vessels up top of the heartbeat, where the blood comes in, that goes down to the ventricles. The right ventricle pumps it back to the lungs. It comes back in the left ventricle, goes down to the right. It's like an orchestra. It's a synchronized pulse of electricity that passes through the atria, the top, and the ventricles at the bottom. And beautifully, it magically, miraculously, it works to give us that love dub, love dub, love dub. When there are certain things that happen, like if you beat a drum, when you ever put your hand on a drum to calm it down, and you can just stop it. Well, that's kind of what happened here. It can arrest the heart. It can interrupt that electrical impulse that will stop the wave that's causing the heart to beat. That's more of your cardiac arrest. Does that make sense?
Yes. So it sounds like, and Dr. Conley, Dr. Maddox, feel free to jump in at any time. From what I've been reading about this, is that blunt force trauma to the chest, based on the tackle that he was attempting to make, it hit him, and that's what caused that arrest that happened immediately. So if something different happens, let me know, because that's what I've been seeing on the internet and reading, but there's a lot of stuff out there. So I want to make sure that we're giving out all this right thing.
Just want to add one caveat. Yeah, it was a blunt force trauma, but anyone that was we were all watching. There was nothing, I'm not going to say nothing spectacular, but nothing really stood out about the hit. Like it was a hit. From the numbers, the chances of that happening is like 1 in 264 million. It happens about 30 times a year around the world out of 7.9 billion people. I'm saying that billion. It was just the timing of it. He hit at that. The impact was at an exact right moment that would throw his heart possibly into what's called VFib. It means when the ventricles, the bottom 2, the big muscles of the heart, they start beating to their own rhythm. And what happens, the purpose of the shocking is to try to shock the heart back into its normal rhythm, in its normal pacing. And again, as Dr. Conti said, I mean, time was of the essence. I know we'll get into later about the fact, he was making an excellent point before we started about the fact that this was at a major event with all the support there. So, I mean, within 10 seconds, within 15, within 30 seconds, time is tissue. So it wasn't just the blunt force, it was the timing of it that just, it happens.
Dr. Conti, I see you shaking your head. Yes, go ahead.
These events, it's interesting in medicine, probably in lots of other disciplines where you study for board exams and things, and they ask you these red herring questions that you never see. And most of us in like trauma, emergency medicine, critical care, probably in cardiothoracic surgery as well, will get this question, even though it's 1 in a multi-million chance, because it's easy testing material. And I, in 20 years of emergency medicine practice in sports medicine, I've never seen it happen. I've read stories about it, but I've never seen it happen. I've never had a colleague that's reported this event to have happened, but we saw on Monday that it happens. And, that the condition, is called commotio cordis, and that word commotio is just like commotion. It's to throw into disorder. So this nice orchestrated heart rhythm gets suddenly shocked into disorder by a perfectly timed trauma to the right spot of the chest. So it's not just any part of the chest, it's a specific part of the chest at a specific moment in time that's measured in milliseconds. and that causes the heart's electrical activity to be disrupted. And it's so rare that it's not even something that in planning for medical response that you even plan for. That's how rare it happens. I mean, you plan for cardiac events, but you're not planning for that specific event to happen. So, I mean, it was extremely rare. I think it's interesting that, in the first, I call it the crisis phase of everyone's response, in the media, on television, on CNN and all the other networks, they were trying to link this to a head injury. And my first thought was there was nothing, one, just as Dr. Griggs said, spectacular about the contact, but that's not how cardiac related events that are linked to head injuries occur. And the first thing I thought was, this is like a board question. I said, this was commotio cordis. I've never seen it, but I just witnessed it for the very first time. And it was, I mean, as a sports physician, it is the worst case scenario anytime, that is our worst case scenario when we're doing field medicine at an event, that we have a pulseless individual on the field. Because it's, with all of our training, it's still tremendously emotional. You've seen YouTube videos of football players and hockey players collapse, and the hush falls over the stands, and because it's traumatic, and it's a testimony to just how well trained the staff was, and how quickly they recognized that something wasn't right. I remember seeing when it happened, the referee and the player closest to him immediately knew that this was not your ordinary fall to the ground after being hit, and summoned for help. And so even that started what we call the chain of survival that made a difference in the outcome.
Dr. Maddox, the word trauma has been said, but there's physical trauma, which happens to the body, and then there is the mental trauma. And what I saw from, for lack of a better term, the gladiators that were on that field, that were giving their all, playing this collision sport, stop and openly wept on that field. What is it like to see, and how does somebody experience that type of trauma when they witness it? What does that do to the body? And then how really, this is probably a question that I shouldn't be asking you, but I would ask you to give your best guess is, how do they get back on the field and compete after watching something like that?
That's a great question, Ellis. I'll say I was watching the game in real time. I am a diehard football fan. I played tag football flag football in college, intramural sports champion. I love football. Watching it in real time, and the difference in watching it on TV versus watching it in the game is they continue to replay it and replay it and replay it. And so I saw that image as I was going off to sleep. It was the first thing that I looked for when I woke up that morning. The first thing that I asked my husband about when I got off today, I want to know how he's doing. And I think everybody that I know who's diehard football, and even those people who are not, but who are just kind of sidebar football fans, have really taken to being really interested in this. The experience on the field is that you identify with the player. And so all of the former football players, all of the existing football players are thinking in the back of their mind, this could be me, this could be my son, this could be my cousin, this could be whatever. And these are people who love him. And so you see the weeping. And, for me, I really felt like, even though it was a very public moment, it felt so private and tender. And so I felt like I was watching something that I should not have watched. I loved how his team members gathered around and tried to protect some of his privacy so that you could not see him or see him in that vulnerability, because we're used to seeing our players as maybe gladiators or tough guys. And so you're not accustomed to seeing that vulnerability. And I think even though we may say this is the battle of our lives, we never actually think this is a battle of our life. And so we were reminded of our mortality. We were reminded of what a brutal sport this is. And, I am on edge when I'm watching these tackles already, but I think you will see the hypersensitivity, the hyper startle now when that happens, and people will be with bated breath as you're seeing it. As it relates to the football player who goes back out, this can really get inside your head. And so the key is, I think, number one, for them to be supportive to each other and to talk through it. The other piece is their self-talk is so important. The rehearsing their successes, rehearsing, as Dr. Griggs said, the likelihood of this happening. This was a freak accident. This is not the norm. And so really doing the mental work, the emotional work to get through it so you can return back to the field. And for some people, that may take working with a psychiatrist or a sports coach, different things so that they can do it.
So, Dr. Conte, when you're treating your athletes particularly after an injury, what typically, I mean, those injuries aren't as significant as what happened to on Monday, but how do you see them working through that injury and then coming back and the process of being able to work through the injury and get back to playing if that's something that they want to do?
And I think that's a great question. And it really has to do, one, with how individuals process trauma. Because, whether it's Dr. Griggs mentioned, or I think you may have mentioned your ACL, that's a traumatic injury. And for many athletes, having a debilitating injury that requires them to have a period of recovery is trauma. And the body will heal according to a set amount of time. Surgeons will tell you what the expected recovery is, but then surgeons will also tell you that how the individual is emotionally impacts their recovery. And so, I think it was great that Dr. Maddox mentioned the fact, because we don't talk about it a lot with sports at any level, even though the data becomes even more and more compelling. My major sport interaction at the elite level is soccer. And, we are now finding that upwards of 60 to 75% of elite level soccer players around the world are manifesting symptoms of anxiety and or depression at baseline, regardless of whether they're injured or not. And so when you overlay just the risks of participating, the expectations of participating, and then overlays a traumatic event like this, there is no timeline for recovery, which is challenging, when you consider elite level sports participants in a multi-billion-dollar business and what those expectations are going to be placed upon them within the framework of trying to recover. I mean, you saw the looks. I mean, you would have thought that some of those players had been, you see those same looks when you see people recovering after a tornado or a hurricane or an earthquake. I mean, that blank stare. I remember the thing that stuck with me was Joe Burrow, the quarterback. I mean, he's supposed to be the leader, the emotional leader, the tactical leader on the field. And I saw that and I said to my wife, there's no way that he is going to be able to go back on that field today. And then you have to think about just the fact that if you are emotionally distracted at the level that many of these players are in a sport where you've got 250-pound people running at 25 miles an hour, where the difference between planting and avoiding a tackle or not is in milliseconds, it's, it has other ramifications that increase risk of injury. So if you're hesitating now because of the thought that I could succumb to this event, so I mean, I think, when you factor all of these things in, I think what the NFL will have at its disposal are, a host of experts and resources available, but the real challenge is going to be that self-talk and that talk amongst themselves to make sure that in those moments they realize that it's okay to not be okay. And that really makes a huge difference when athletes can bond at that level. And so it's going to be really interesting to see how the players respond, not just the players who were there, because this is affecting every player in the NFL, every player who's an elite level football player anywhere. I mean, I just know the calls that I'm getting in the text from high school kids at the school where I'm the medical director who are asking about this event. So I know what must be going through the minds of professional football players and high level collegiate athletes. And, you know, I don't know what the timeline's going to be. I don't think anyone is going to reasonably recover anytime soon. And it doesn't mean they can't participate, but it just means emotionally, you know, the league is going to go on, the season is going to go on, the playoffs are going to go on, but this is going to stick with everybody who saw that for a long time.
Can I
Yeah,
chime
sure.
in? So there's a couple things. You're absolutely spot on. Just thinking of it from the perspective of being, I mean, that was a very intimate event. We're all traumatized. We all witnessed a catastrophe. And, you know, having played sports, I'm assuming that all of us have played at some level on this call. Especially if you played football. Even if you're playing flag football, you know there's a risk. Your mom and dad tell you, you be careful. I don't want you playing that football because you could get hurt, you could get injured. You know, there was an adage that was told that to me that you know, when you step into the boxing ring, everyone's afraid. The difference between the winner and the loser is the hero is able to step into the fear and the coward runs away from it. We're all cowards to our worst nightmares. What happened is the worst nightmare of anyone that's ever put on a pad. You know, it's a possibility that it could happen. The fact that it was not this over the top magnanimous collision didn't make it any better. It was just
Right.
it was a hit, and the fact that it could happen. Every person in your life that ever told you be careful playing that sport. Every ACL you tore, every finger that you broke, every nose that you got, every tooth you got chipped, every person that told you be careful, it came back at that time. So what we're all waiting on, and Dr. Maddox, you said it, is you know, and it's kind of the exact same thing. I can't stop checking to see as soon as I see update on my phone. I'm like, wait, what'd they say?
Right.
And what we're waiting on is if you've ever been on the field when someone's been injured, or the court when someone's been injured before, we're waiting on the carry off the field. We're waiting on, there it is, right there. We're just waiting on a thumbs up.
Yeah.
He's going to be okay. We want to, this is what's going to be done for his kids, his family, his mom. They're going to be okay. Even though he might not be able to play again, they'll be able to do this and he can be happy and it will be okay. And right now we're all holding our collective breath. And the only thing that we can do is we got to talk it out. I mean, you know, the thing that you miss most about playing sports, I know people that still, they still glamorize their bitty ball, their 5, 6, 7-year-old soccer team and how close they were when they won the championship. Bad News Bears in baseball, but they're bonded like they're blood relatives for the rest of their lives. It's that is what you meant. It's the locker room. You know, you keep, you know, Griggs, Dr. Griggs was, he played football and no, Dr. Griggs was I would have been Rudy's backup. I was a walk-on. People say that you know, you played. No, you were being very kind. I was a walk-on. I was decent and I was good as well. But the point is, it's the locker room. It's the bonding. And that's the other part that we have to remember, that we're humanizing. It humanized him as a person. And we're never ready for our gladiators. We're never ready to know their story, right? Yeah. And we never want to know anything that happens to them in front of our eyes, because we're connected. There's a lot of emotion in this that we still have to process. We're just waiting on this.
Right. And I'll agree with you. Well, I played flag football and we were the intramural champions. Let me put that out there. I remember breaking someone's nose in flag football, and I did not. And while I kind of got the nod, I didn't feel good about that. I say, as we're looking at this also raises the issue of what happens afterwards. What if he's not able to go back and play? Is he vested in football? Does he have disability insurance? What are the health sequelae? What are the long lasting things that happen to this young man who's only 24 years old? And every physician on here knows that if you are 9 minutes out with CPR is concerning, is very concerning. And what now? The conversation about disability and life after football, this puts that at the forefront. And I've not heard enough of those types of discussions, but that's really critical because his future, we want his life back, but it also puts something out there as it relates to the longevity for your football players as well.
So Dr.
And the thing
Maddox,
is, we're praying every moment right now. We're talking about disability, but right now, especially as the doctors on the call, we're praying for the progression. He's still in the ICU. He's still on the vent. There's a long walk and road and there's just certain things that we're listening for. And I'm just don't talk about that. That's all I'm waiting on. Just progressing.
Yeah, I'm waiting for 2 words, but stable. Because I keep hearing he's in critical condition, but I don't hear the critical but stable. So I was like, when I hear the but stable, then I'll exhale a little bit. But when I keep hearing he's in critical condition, that's when I'm still on pins and needles. So Dr. Maddox, one of the things that, I played 1,000 years ago, way before social media. It was a newspaper guy that was writing stuff about players that could play back in the day. Social media has changed that because, and 24-hour news cycle and ESPN and all of these different organizations. And now we get everything. We see everything. We know about somebody getting murdered in California or overseas, and it brings everything to the forefront. How do we get past that as fans? Because you said you get up this morning, you're checking. Dr. Griggs, as a fan, as a former player, he's checking. We're all checking. So it's raising our anxiety level. Mm-hmm. And as Dr. Conte said, this is a very rare situation. Dr. Griggs gave the numbers. It's like 1 over 200 million chance. Only 30 of these happen a year. And yet we all are here connected because we all seen it over and over again. And it feels real and it feels like it could happen again at any moment. How do we get beyond that to where we can go back to enjoying the game the way we used to?
I'm not sure if I'm going to enjoy the game the way I used to.
Got it. Okay. Yeah.
And I say that I need to hear that he's okay before I can enjoy the game. I need to see the thumbs up. And so for me, I am, the prayers I think are good. I love the conversation that we started with around that Dr. Christopher started with around what policies can be in place for the high school sports team, for the college sports teams. Do we have the athletic directors and the referees getting training in CPR? I love that. That makes me feel like I'm doing something. Right now, I feel powerless, and I don't like that feeling of powerlessness. And so in my mind, I want to go to how do we keep this? How do we ensure that should something like this, God forbid, ever happen again, that we are able to leap into action just as they were, and that we're able to create the opportunity for a good outcome. In order for me to distract myself a little bit, and I hate to say that because that sounds awful, but I feel like we need to make sure that other people have the opportunity to have the same quality care should something like that happen to them.
And that is such an awesome segue into that conversation, because it becomes practically relevant, but it's also, just as Dr. Maddox said, potentially therapeutic, because now you can become somewhat more empowered to know that I may not necessarily positively affect the outcome, but should something happen in my space like this, I at least know that I have had the proper training, had access to the proper resources, and could maximize whatever chances. In emergency medicine, I've found over the years that those family members who are made to feel that they're validated, that they did everything that they could. The family member collapsed in front of them at the family reunion. They recognized that they activated the 911 system and they started CPR. Even if the outcome is bad, those individuals have a level of contentment knowing that they were prepared and did everything they could. And right now, that's not necessarily the case. So to put, I'm like Dr. Griggs. I love numbers. And, right now there are 34 million kids aged 6 to 17 participating in organized sports. About 7 million of them are high school or middle school age kids, and about 500,000 NCAA collegiate scholar athletes. So a whole lot more college and high school and middle school athletes out there. And as we were mentioning just off camera, that you would think that with the stories that we hear every summer, during 2-a-day football practices and this, that, and the other, where people are falling over and collapsing, that you would be very surprised to know that right now that there are 17 states that don't require CPR training for their coaches at the high school and the middle school level. That doesn't necessarily mean that every school district in a state where it's not required doesn't have their own internal requirements. But the fact that there's 17 states where CPR training is not a requirement to coach high school and middle school student athletes is a problem. So things that parents can do to become more empowered is ask your school board, what is our response capabilities I noticed I was at my son's basketball game and there was no trainer. I noticed that there was no AED, so there are a lot of things that we can do as individuals to educate ourselves, because we're, in our lifetime, we probably will not see another incident of this if it turns out to be that 1 in 7 million rare event that we believe may have happened this time. But we are far more likely to find someone jogging, that our neighbor jogging, who now we find them, collapsed next to the mailbox, or, so there are things that we can tangibly do to help prepare ourselves and to be trained and to make sure that the spaces where we participate in physical activity and sports are better prepared. Because the reality is that, when your kid is playing Little League baseball or Pop Warner football, there's not going to be a paramedic and an athletic trainer unless they get to the highest level of competition in the championship. But there are going to be a lot of parents around. And so if we've got, 200 parents watching the game and 25 of them know CPR, the likelihood of a better outcome in the event of a bad thing happening is much higher. And those are tangible things that we can do, that right now is a great opportunity to have those conversations, because it's on the minds of people. And from the empowerment standpoint, when you feel empowered, it helps you recover. Again, I'm not trying to tread into Dr. Maddox's behavioral health lane, but I just know for me, when I'm trying to recover from something, I'm trying to latch onto something that empowers me in some way. And so these are some tangible things that we can do. The American Heart Association, the American Academy of Cardiologists, the Boys and Girls Club, they have training for these sorts of things, so that we can prepare the community better. So I think those are ways we can help use this tragic event to increase awareness, because there are a lot of younger people and older people who are not going to have the value of having all of those resources literally 20 seconds away when something happens.
Well, Dr. Conte, to your point, one of the biggest tools that we have right now is Google. If you can go on, everyone within the sound of our voice can go Google hands-only CPR training near me. There are trainings going on every day where they've even gotten rid of the mouth-to-mouth portion, where you can at least learn with the hands only, just to keep the heart pumping, to be able to do something immediately while you're waiting on the EMS. That's very empowering. That was empowering
And,
just for you to bring that up.
and if I could just add really quickly to the CPR point, over the last decade or so, there has been a movement towards what's called compression-only CPR.
Yes.
Really doing what Dr. Griggs is talking about, circulating the blood and the oxygen. Because to be honest, in the post-HIV world, and now obviously in the post-COVID world, there's a hesitancy to want to put your mouth on someone and do that mouth-to-mouth resuscitation. Well, now we know that if we can just keep the blood circulating until help arrives. And so, compression only CPR just is a matter of knowing where to put your hands and at what rate you should be pushing. And those are things that even without, a formal class, I am not an advocate of the University of Google or Medscape College of Medicine, but you can learn how to do compression only CPR in a pinch by watching it done. And it being done online if it's done by a credible source. So, compression only CPR is a skill that is just a matter of you knowing where to put your hands and how quickly to compress and what rate. So, and that can make the difference. If the average response time in America right now for pre-hospital providers is about 7 minutes. 7 minutes of compression only CPR means the difference in many cases between surviving and not surviving. Because on the back end in the emergency department, I see lots of bad outcomes where the person collapsed and 911 was called and no one knew what to do. So in those 7 to 10 minutes while they were waiting and praying and hoping, no one was circulating the blood and the oxygen. And by the time the medics arrived, there was nothing that really they could do. So again, I think that's a great opportunity for people to learn and to acquire a skill that could save a life.
So, is it still Staying Alive? Is that or is it a new
Staying
song?
Alive.
It's still Staying Alive. Okay. So if those of a certain age understand that song. Some of y'all newer folks may not understand. So just look up Staying Alive and not the Drake Staying Alive. That's Drake and 21 Savage. I'm talking about that one. I'm talking about the Bee Gees from the 1970s, Staying Alive. That is the right beat. But in all seriousness, what we're talking about is the healing process, right? And the healing process mentally for us as a fan base and people that watched it, that traumatic event, is part of that healing is, okay, how do I prepare myself in order to be able to deal with this? If I find my neighbor in the mailbox, or if I find that neighbor that decides they want to run a 5K, or you're running a 5K and somebody collapses next to you, how can I be trained in a better position to be able to respond to that situation? So that's number one. Number two, Dr. Griggs, is we talked a little bit about the difference between a heart attack is that blockage, and cardiac arrest being that heart stoppage. And so a heart attack can lead to cardiac arrest, not the other way around. So we understand that there's a distinct difference.
Yeah.
What I have heard, and so I'm going to, put out one of those medical myths, is if somebody is experiencing a heart attack, you can give them a baby aspirin, call 911, and then get them to an emergency facility. It sounds like with cardiac arrest, you need to engage in some sort of, even if it's just the compression, you need to engage in some sort of CPR activity, because that baby aspirin is not going to work if that heart has stopped. Are you on track with that?
You're absolutely on track. The first thing that you need to do in any case is you need to call 911. You need to call EMS. The sooner EMS is on the scene, the better. There have been situations, I've been in situations where, you're doing what you can, but sooner EMS gets there, you get out of the way. And that's one thing that we don't want people to do, is feel too empowered. Let the people do their job. Let them get them to the back to Dr. Conti as soon as they possibly can, because you don't walk around with the cardio drugs in your pocket. You're not qualified to give them. But you're spot on. You're spot on. The sooner we can get help, if you remember the old videos with CPR, the help, call 911. It all seems really corny until it's real. You talk about, I would encourage, to Dr. Conti's point out, I would encourage all parents, all referees, all students of age to learn at least compression only CPR to be able to recognize when someone's in distress, because these numbers are amazing. 10 seconds, 15 seconds, the ones that you rattle off. And it truly is, time is tissue, and it's truly a matter of life and death. Yeah. But can I say this? I know we are the panel. We're giving the expert. This conversation is therapeutic for me. It's helping. So it's nothing to experience. I'm gonna tell you, one of the worst things that we can do is experience these things alone or in isolation. You watch it, you're traumatized, and you don't talk to anybody about it. Put it down. Call someone. Girl, did you see what just happened? And let's talk about it. Let's see if BlackDoctor.org has that recording where Dr. Maddox and Dr. Conti and Ellis and Dr. Griggs on there talking. Maybe they say something that'll make us feel better, that maybe they can help us. But put the phone, stop. You're repeating the trauma over and over again.
And if you're the parent of a young football player who saw this, I know how sometimes how sports parents can be, and we enable the just suck it up and push past kind of a thing. But this kind of trauma is insidious. I mean, there are young people who play football now who go onto that field with a healthy amount of angst and fear all the time, and now on top of that, in the back of their minds, they're thinking, this could be me next time. And they need to be able to know, whether it's from a coach or a parent, that it's okay to feel that and to think that, and it needs to be validated, as opposed to just telling them to kind of like put it in a box and leave it over here on the shelf, which again, I'm not speaking in general terms or specific terms, but we know that sometimes, especially in these gladiator sports, a lot of coaching is about trying to get people motivated to go out there and be gladiators. And so there's not a lot of talk about fear and not a lot of talk about anxiety and hesitation. But in this particular case, this is a different kind of trauma. And I can tell you, I know in Western Pennsylvania, we play football in the fall, so the season just ended. But in places like Texas and Georgia, in places where they play football year round and they are getting ready to start their winter league, there are a lot of kids out there right now who are having some thoughts. I won't say second thoughts. They're just having thoughts about, do I want to go out there? I don't want to run across the middle and have this happen to me. Or if they're really discerning, they're going to look and say, just like Dr. Griggs mentioned, that did not look like a particularly forceful, fierce contact. And yet now we've got a young man that's in the ICU on a ventilator. And that's a very real feeling. And so I would encourage you, if you're a parent or a grandparent or a coach, if you're confronted with this in the next days to weeks, just validate it, and don't be afraid to say it's out of your element. And I don't know how to answer that question for you, and I don't know how to help you, and to then direct them to resources that can help, because that's the best thing you can do for your athlete in the short term. But it also teaches them this level of self-care that they just need, because it's even after they finish playing football and they become the next panelists on this show, the next generation of doctors, they're going to need to be able to self-care, to take care of themselves. And these skills will help with that.
I think.
Can I just add that, just as a parent, and Dr. Maddox, not in your lane, because this is drifting more and more up towards your lane, but as a parent and as a former coach of kids, if you have a kid that's really pushing back, that doesn't want to do it, do not force them to go out there. Football is not a sport. It's not a sport where hesitancy, self-doubt, there's no room for any of it. If the kid is really saying no, I know you might be wanting to live through your kid, live that dream. If the kid says it's over, do not force them, because the last thing you can do is not be able to protect yourself and doubt yourself.
one of the important things to what you were saying is allow them to have that grieving process and then bring them back to
Yep.
some of the stats that Dr. Griggs and Dr. Conti talked about in terms of the rarity of this. Talk to them. And so allow them to take a pause. Perhaps they don't want to, or get back on the field quickly and play, but not so intensely. Have them to rehearse their former successes and remember those things, as well as visualizing them being successful. And it's okay to talk to a professional, somebody who has expertise in this area, so that you can navigate some of those underlying fears and what that means. And I think giving them the space to just talk it out with someone that's not pressuring them, because parents, sometimes we need to see someone, because we're trying to live vicariously through our children in a very unhealthy way.
I promise you, you're on my block right now, Doc. You're on my block right now, because I was
Mine too.
I'm on my block as well. Okay.
Mine too.
I coached my son all the way through, and then after his 9th grade season, he said, "Dad, I don't want to play football anymore." And he was very good. He was a fantastic player. And
Ellis, that's
had that
happening to this
moment,
day.
right?
I see pain in your face right now.
It did. Like he told me, and it took me about 3 days before I responded. Right? Told the wife first, because that's what to do, and then it took me about 3 days before I responded to him, because I had to stew on it, and I realized if he's not enjoying it, if he's not really loving the sport, football's not a game that you can play halfway.
Right.
And I realized that the love was the parents patting me on the back. Oh, that boy can play. Oh, he's great. The other coaches wanting him to play for them. That was parental ego. That wasn't him. And so as parents, we have to recognize. So what Dr. Maddox is talking about is 100% true. We have to recognize and have some self-awareness about living vicariously through that child, because when he was running up and down the field scoring touchdowns, I felt it was me. I'll be running down the sideline, go get him. And I'm telling anybody who is and getting everybody, getting all the lights and let your boy play football. That was me. That had nothing to do with him. He was the one on the practice field. He was the one putting in the work. He was the one getting hit. He was the one facing all of that. I was there soaking up the accolades. And so what we've got to do is be very, very careful in that space as parents about what messaging we're sending to our children. And so we have to recognize that. And to Dr. Maddox's point, and throw it to you, Dr. Conti, is finally, as coaches, when coaching, you have to coach the entire person, right? And so it's a delicate balance, right? Because you have to teach them to go out there and play without fear, and play with passion and emotion and energy, and commit 100%. Your mind has to be free, and you have to play free. But then this trauma happened. And so we've got to be able to really let them work all the way through that. However, they're individually dealing with that trauma that they witnessed. So if they do want to get back on that field, they can do that completely and not have that little thing in the back of their head. Because you're right, Dr. Conti, that's when injuries happen, when you're not playing 100%.
That's right. And, and just as Dr. Griggs mentioned, the difference between a heart attack and sudden cardiac arrest. And, I believe that there are some rumblings out there, especially among perhaps some younger athletes, that, now they're making these indirect connections, like football can cause you to have a heart attack. Well, that's not the case. So I don't want young athletes out there thinking that playing football now is going to increase their risk of having a heart attack. Just as Dr. Griggs said, a heart attack is when the blood flow to the heart muscle gets disrupted by a clot. And there are risk factors to that happening, high blood pressure, diabetes, cholesterol, family history, smoking, vaping, young people, if you're listening, vaping, I'll say it again.
Did you say vaping?
I did say vaping, yes, because a lot of them are vaping. and playing high level sports, you know, and those risk factors are what predispose you to have risk of not only heart attack, but also stroke. But playing football in and of itself is not going to increase your risk of having a heart attack. So I wanted to make sure we, you know, shared that, because I suspect that there are some out there who have made that kind of connection in their minds because they've maybe heard it somewhere. And that's just not the case. So, you know, again, a very rare event that we just unfortunately all bore witness to. But the likelihood of it happening in any given football, I mean, how many years of football watching and playing experience do we have just on this panel? And none of us have ever seen it, experienced it, other than Monday night. So it's very, very, very rare. But the emotion attached to it is very real. So, you know, I hope that people take away from this something positive to help them process.
I want people, when they think about this, whenever you feel that little sense of angst in your belly, I want you to reach out to your school board, reach out to the principals about having the coaches trained, about having the referees trained in CPR. When you feel that and you feel that sense of powerlessness, empower yourself by using your voice to encourage very local changes in the communities you serve. While we may not be able to make anything a national, federal law, we can do what we can, use what we have, start where we are. And that may be your school, that may be your college, that may be the church auditorium if you're the security and you're electing to get CPR certified, but do something.
Because right now, from in the school age population for at least the last 20 to 30 years, more than drunk driving, more than drugs, more than falls, sudden cardiac arrest is the leading cause of death in school age children in the school space. And that's not on the sports field. That's just in the building. But it's also the leading cause of sudden death in school-based sports. So it is money and time and energy well spent by a school board, by an athletic department, to train as many people in the building as possible. In Pennsylvania, for example, it is in the state law that high schools have to offer an elective in CPR for juniors and seniors who want to take it. And if the school can't provide it in the school has to make a way to give those juniors and seniors access, which, you know, ideally we want everybody to have access, but that's at least a step in the direction, noticing, you know, realizing that the more trained people in the space, the more likely you are to have something happen in front of somebody who's trained. And that's I mean, with all the things that school boards talk about, this is a very real and relevant thing that I think is often overlooked. So just as Dr. Maddox said, that's time well spent to spend time sitting in, you know, 2 hours of a school board meeting for you to have your 5 minutes on the mic to say, hey, well, what about CPR training for our coaches, our students, and our staff? Because that can go a long way, and it may just save somebody's life. Not just a kid, it could save a teacher's life or a coach's life. So I think that's a great point.
Well, one other thing, if I can just add, I got to add, it's directly to the student athletes that are old enough and to the parents. How many times have y'all gotten calls where someone just wants you to fill out a physical form for a kid so they can go play? Do not skip a step. I don't care if the doctor's your brother, your dad, your friend, the deacon at church. Take that child, that athlete, to go get a thorough physical exam. And if they do, oh, it's just a little murmur. What do you mean when you say that? Give me the exact word. If it's mitral valve prolapse, get it looked at. You don't want anything. The last thing that we want, we're all looking for this and this. What would break my heart is if he had some type of undiagnosed cardiac condition that went undiagnosed and he's a pro. That means that he was just skipped along, because we know how the system. Ellis, you remember those? Do y'all remember those physicals? I mean, it was a quick. Do you have any ethical? Do you have anything? Do you have anything? You're allergic to anything? Okay, great. All right. Am I right?
100 in an hour.
There's a reason why, you know, on these school-based forms, why there's a special signature line on almost every school-based form now for sudden cardiac arrest. And how many parents have really read the disclaimer? Because I know in Pennsylvania, the disclaimer for signing about, I understand about sudden cardiac arrest, is that if you read the bottom of it, it says that it is highly recommended that all student athletes be considered to have an EKG as part of their evaluation for their pre-participation physical. Now, knowing that that doesn't happen all the time, but I think it's interesting that it's on the form. So, you know, again, you know, I see athletes all the time. You know, as a varsity soccer coach, I know when the physical deadline is for them to be able to participate in practice, and I know that they went to the local urgent care, paid their $40, and I venture to say that many of them did not even see a provider of any kind, a nurse practitioner, a physician, a PA, and someone signed the form, checked their height, their weight, their blood pressure, their pulse, and their vision, and cleared them fully to participate without restriction. And that is, you know, as much time, energy, and effort and money as parents spend in their allowing their children to participate in sports. This is the one area, just as Dr. Griggs said, where we don't want to cut corners. And that doesn't mean you have to set them up to see a cardiologist, but you also can ask, even if you go to the urgent care, say, hey, I noticed you didn't even listen to my child's heart. Did you hear a murmur?
Yes.
You know, why, you know, you have the right to ask those questions and to say, hey, well, you know, this runs in our family. And I know you said my child doesn't have a murmur, but would it be possible for my child to get an echocardiogram, which is an ultrasound of the heart? Because, you know, their uncle had a heart condition that was diagnosed when they got to college, and their first cousin, you know, had an event. So again, being an empowered parent and an empowered athlete does go a long way. And because again, because even if things are disclosed, it's not necessarily a no play thing. It's just now you
Right.
know what's going on, and it's better to know than to not know.
And it's another show, and Ellis, it's another show, but especially parents and athletes, you can frame it with respect to all of these viruses that are out here right now. Viral myocarditis, the numbers are up. And it's most likely seen in younger folks. The viral myocarditis, it can lead to arrhythmias. You just want to be thoroughly checked out. You shouldn't take better care of your car than you do your body or your child.
And I'm going to throw out there, while we are talking about what to do in school, we have people going to church on Wednesdays and Sundays. If you are a pastor or part of a ministry, also have this conversation with your teachers, your ministers, those people there as well, because we have a whole lot of the Black population who will show up in church on Wednesdays and Sundays. Encourage them to get CPR certified. And if you have a ministry, you know, you may want to have some additional requirements for that as well. We can't leave the churches out.
Can't leave the churches out.
So, guys, I want to. This has been a fantastic. Yeah, absolutely right. And I know I'm glitching, so I hope y'all can hear me.
We can hear you.
Because my internet is acting funny. But okay, great. So, cardiac arrest and heart attack are not the same thing. So let's stop using those terms interchangeably. Number one. Also, number two, if you can get certified in just compression training, get certified. If you can't do the full CPR, get certified in compression training. Number three, go to your school boards. Make sure that our kids are protected at the earlier stage, because the athletes, the professionals, the NFL level, they got people all over. Dr. Conte tells about it. They got people, staff, emergency training, defibrillator, everything right there at the professional level. They've got the money for that. But we've got to make sure our kids have it. We've got to make sure our schools have, our local schools have, and that's where you have the most power. You've got in your community cut corners. Listen to your children, to work through this at their pace, not try to accelerate through this process with them. Work through them with it. If they want to continue to play, let them continue to play at their pace. If they don't want to continue to play, you got to be okay with that. As a parent, you got to be okay with that. In those school boards, have them stop arguing about CRT and start arguing about CP. And that's the last thing I'm going to say. I want to say thank you, everybody, for joining us tonight. Thank everybody for joining us tonight. Shout out to Georgia. I just saw some people that put this at Georgia. I'm living in the great state of Georgia. So, they have training in schools. Thank you to our guests, Dr. Conte, Dr. Griggs, Dr. Maddox. Please, 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 I'm going to re-air this tomorrow morning. Please have these conversations. Work through this because the games are going to go on. It's a multi-billion-dollar industry, and it's not going anywhere. It's not going to stop. So what we have to do is make sure that continue to pray for the player safety that are playing in the professional levels and work for the safety of our kids that are playing in our middle schools and high schools and colleges. And thanks again. Thank you for joining us, and we'll see y'all next time.
Thank you.
Thank you.